Hi, Kelly Shaw's my name. I'm here in Public Health today and I'm having a chat with Scott about public health. So thank you, Scott, for agreeing to talk to me today.
Thanks, Kelly.
Can you tell me, first of all, what your role here is in public health?
My role in the Public Environmental Health Service is that of Senior Environmental Health Officer. Basically, I'm an authorised officer under the Public Health Act. The Act has approximately 14 different legislative guidelines that fall out of the Act. The Act is the head of power. The guidelines are effectively regulations which get their head of power from the Public Health Act.
Yeah.
The divisions in the Public Health Act cover a number of areas such as public health risk activities like tattooing, body piercing, anything basically where there's a skin penetration element, also guidelines for drinking water quality, guidelines for recreational water quality, guidelines for places of assembly, guidelines for the control of salaria, and guidelines. There's a few others that I can't reel just off the top of my head that I've forgotten about, but basically I'm responsible for the administration of those guidelines and how that legislation is then subsequently enforced at local government level.
Okay. What's your background? How did you get into this type of work?
That's a good question, actually. I was actually trying to avoid going on holidays with my parents to the Gold Coast after HSC. That's how I initially, on the promise that I'd look for work while they were on holidays, which I basically
So you went surfing?
Yeah, I went surfing and other activities associated with that for a couple of months and spent the budget allocation, and then, of course, I didn't have a job when Mum and Dad came back. So.
Right.
So I was slightly embarrassed. But then a position, I actually had one of my dad's auntie was an old matron, I think was the definition, nurse type thing.
Head nurse in a hospital?
In a hospital, and she mentioned to my father, she said, has he thought about becoming a health inspector? Because at the time I was actually contemplating a career in law.
Okay.
Or it's a bit varied actually, economics or an art teacher. So I'm a bit sort of slightly schizo, but anyway. But and out of all of that bunch, I then became an environmental health officer.
Is that what a health inspector is?
Essentially, it's the old terminology was health inspector, and actually when I applied for it, wasn't health inspector, it was health surveyor. That changed the name. There'd been a name change, I think, to try and I don't know, raise the profile of it potentially. But I became a cadet health surveyor and. Studied a certificate in health surveying through the TAFE College at the time, which was, I think we had about 32 subjects of varied backgrounds and interests that we had to get through.
Yeah.
I then completed that and plus a 4-year on-the-job training with the Hobart City Council.
Yep.
After a year and a half there, I basically got a little bored with the city environment because the work was more limited to food inspections because of the number of food premises that exist around Hobart.
Okay.
I then moved to the Glenorchy Council, which had more of a rural base with Molesworth and Collinsvale, because I wanted to improve my expertise around on-site wastewater management.
Right.
And because of Collinsvale's unsewered areas, that was a big part of the job there.
Yeah.
Basically got rather bored with Glenorchy Council within about 18 months of being there, and then sort of made contacts with which was then called the Public Health Inspectorate. It was the Chief Health Inspector and the Senior Health Inspector at the Division of Public Health, and at the time...
in state government?
That was state government, yeah, and basically I got a call from Phil Knott one day, and the next thing I knew I was working in as a health officer, actually we were called a health officer, authorised under the Act, and basically began learning the ropes of what that involved, because a lot of the work that we do is not only administer the Act and the guidelines, we actually develop the legislation and write the legislation.
Okay.
So that's part of my job at the moment, is I write legislation and then obviously go through the consultation process with industry and stakeholders before it's actually implemented. And it's an ongoing process.
So does local government still have environmental health officers that do the job that you used to do with food inspections of restaurants and wastewater and that sort of thing?
They do, yeah. Okay. So it was local governments are it's hands-on work, if you like. They deliver the legislative requirements that we bring in.
Still under the Public Health Act?
Still under the Public Health Act, and I think just broadly speaking, environmental health is all about managing the built and natural environment, so as the impacts are minimal impacts to public health from the way that those buildings are managed, buildings are designed, and environments are managed essentially, whether that's water, soil, also it's a broad scope of environmental commodities that you actually try and regulate
Okay.
in order to improve overall public health outcomes. It's a very proactive approach
Okay.
to health. It's probably the opposite scale to primary healthcare.
Okay.
Yeah.
So you mentioned before that you spend a lot of time in water and regulating water quality.
Yes.
Can you tell us a bit about what that's about?
A large part of the job is my job is dealing with actually recreational water quality. So under the Public Health Act, we issue guidelines for recreational water quality, which essentially the actual monitoring is conducted by councils, because councils are best placed in their communities to actually, for one, know where popular recreational water sites are in their municipal area.
Drinking, swimming, boating.
Swimming's the primary contact activity that causes the potential for risk. Contact with pathogens through water, whether it be from stormwater runoff, failed sewage systems, industrial inputs, all sorts of things.
Okay, right.
Dog feces on footpaths is a huge one. Which all get washed after heavy rain into the water, basically. So we require the councils to monitor all of the popular recreational sites in their municipal areas. And then we use the national recreational water quality guidelines, which are developed by the National Health and Medical Research Council, and they set parameters for suitability or otherwise for contact with water. So we get the councils; they do bacterial monitoring over the series of a summer, summer season, because that's the risk period. People in Tasmania don't tend to swim in winter time.
Put your head on an iceberg.
Oh, I do, but you don't have a wetsuit on. But but anyway, so we get them then to analyse all of the results from a particular monitoring sites across the municipal area.
Yeah.
And from that, determine whether those sites are suitable or not in a general sense for primary contact behaviour like swimming.
Yeah.
And also to assess after known risks occur, like a sewage overflow or whatever, they're sort of instant response incidents that they would then go down, sample, and if it didn't look good, if the results came through too high, we then close the beach. We advise people not to swim. We don't actually close it.
Okay.
We just advise them.
And how do you do that?
We advise that through signage, media releases as well, and then the councils will go back, and our guidelines permit, once the site's had two clear results, we use enterococci indicated bacteria. If they get two that fall within the parameters we've specified in the guidelines, the signage can come down.
Okay.
Yeah, so, and it's I find it interesting personally, because I've got an interest in water quality.
Yeah. So other than recreational water, you mentioned drinking
water, that used to be a more significant part of my job, and it still is in terms of I'm on basically 24/7 on call.
Okay.
And I do a lot with the Water Corporation, so if they have a failed result, and under the Public Health Act guidelines for notification of contaminants, as soon as the laboratory gets a failed result, we notify within 24 hours, and then we follow up with that. So whilst the policy work is now more done by a state water officer, the actual response work for the drinking water failures I still deal with.
So to figure out what went wrong and how to fix it.
Yeah, and the Water Corps will typically ring, will say, oh, well, look, we've had a high reading at Kempton, which will have an unroofed reservoir on it or something like that. Actually, probably best not to mention the name of the place, but we have a high result. He would then run through the details of the system with me, and what actually, whether it's a roof reservoir, there's a risk factor there. If it's not, chlorine residual evaporates a lot quicker out of unroofed reservoirs, so you don't get the same disinfection efficacy, and it drops off very quickly. So a lot depends on the nature of the system, and they then provide an incident report to me, which they send in and confirm actions taken. And so it's a duty of care thing. So there's lots of safety nets there for the public.
Okay.
And if water's particularly bad, we'll run it offline, so it won't go into the system.
Where does drinking water come from in Hobart?
Beyond the clouds.
Yes. Is it from the river, or is it from...
The greatest percentage, or 99% of it, actually comes from Bryneston, just north of New Norfolk. And Hobart's, I think the actual storage capacity for Hobart is about 3 days.
Okay.
So it's constantly just running through the system.
Right.
So the amount of water that Hobart has at the moment is basically restricted by the storage capacity after disinfection.
And how do you
clean it? Which isn't great. Oh, the water treatment process. Well, they draw raw water straight out of the river, which incidentally, the stuff that goes through Greneston, a lot of the time it would probably be okay without any treatment.
Oh, really?
It's that good, the actual raw water.
Yep.
It then goes into large settling tanks, or if you like, reservoirs, and then has flocculant added to it to take out turbidity, which reduces the efficiency.
Gets rid of the lumps. Yep.
Yeah, of disinfection, because bugs hide behind particles in water, blah, blah, blah.
Okay.
And it's fluoride. We add fluoride to the system, of course, to make sure that we don't suffer from premature dental caries and things like that.
Yep.
And then and chlorine, and then it's distributed out to the various distribution networks in the system. But the whole system's designed so we can actually defer water from one source and isolate certain parts of the network in the case of a contamination event.
Okay. So when you talk about contaminants, it can be bugs or bacterial infections or viruses, but it can also be things like heavy metals and particles.
Yes, it's not just micro is the number one risk in terms of hierarchy of needs. It'd be micro, and then probably I'd say chemical. And then parasites, Giardia, crypto, that type of thing.
And that's all tested for to make sure that water stays of good quality?
Yes, yeah. All of the supplies are tested every week.
Right.
And in basically you'll have a network. If you have a treatment plant and it's distributed out to a suburb, if you like, the people who are the furthest away from that treatment plant, they're the ones that we actually target for sampling, because that's where the chlorine residual is most likely to be depleted.
Right. Okay.
So if you sample close to the treatment plant, you'll always get good results.
Right.
Yeah, so which is an element that the Water Corps have actually brought to it, more of a risk-based approach than previous regimes.
Fantastic. Well, we're out of time, so I just wanted to stop there and thank Scott so much for a really fascinating discussion about being in public health, environmental health and water quality. So thank you, Scott.
Thank you.